Okay, we're going to get started. Let me introduce myself and then I will introduce, I'm your presenter, but I'm going to introduce the rest of the AHEC team from this area. My name is LaShonda Sanders and I am the Health Careers Coordinator for the Northwest region of this area, okay, for Bayou North, and we'll talk a little bit about that. Ms. Ashley Morgan, why don't you introduce yourself and tell them who you are and your role in this.
My name is Ashley Morgan. As she said, I am Executive Director for Bayou North AHEC. Bayou North oversees 21 parishes in North Louisiana, so from East Carroll, which is in way east, all the way over to Sabine Parish is where we cover. So if you're interested in placements in any of those parishes, then you will be linked up with myself or LaShonda or our other partner in Monroe.
Gabrielle?
Hello, good afternoon. I'm Gabrielle Juneau, CEO for Central Louisiana AHEC. So Central AHEC has a 17 parish service area that covers from Winfield through Alexandria down into the Baton Rouge Ascension parish area. So just a show of hands, how many of you are from Alexandria or Baton Rouge area? Okay, great. So if you end up applying for this program, you would be in contact with either myself, Ms. Polly Holland, who will introduce herself, or Miss Angela Wright in our Baton Rouge office. So very excited to have y'all here. Welcome. And Polly.
Yeah, my name is Polly Holland, and I'm the Central Louisiana Area Health Coordinator in the Alexandria office. Nice to meet you guys.
And Miss Shirley, who is the, I was going to say brains behind this operation, but Miss Shirley, yes, okay. No.
Hi, I'm Shirley Wilson. I am the AHEC coordinator here on campus at LSU. Our office is on the 5th floor. My office number is 5-306. So if you need anything involving AHEC or have any questions about AHEC, I can be found in the pediatrics department on the 5th floor. My director is Dr. Wanda Thomas. She's a pediatrician here, and she will be in shortly, so you guys will get a chance to meet her.
For those of you who are going to stay in this area, you're going to actually turn your applications in to Miss Shirley, okay? And so you'll be seeing more of her. So again, my name is LaShonda Sanders. I've been with Bayou North for about 3 years. So this is one of my favorite programs, and I hope you enjoy what we have to offer, and I can encourage you to participate. So the program is called Primary Care Rural Preceptor Program. You'll hear us refer to it as PCRPP, okay? That's who you are. You'll see that acronym, so that's what it stands for. Okay, so during this brief presentation, I'm going to talk about the mission of our program. We're going to talk about AHEC, who we are. I'm going to share with you some benefits of the program, what you're going to gain from this. There is a stipend, so yes, money is involved. However, we want you to understand that our goal is for you to get the experience, and it's a greater value than the money that you'll get at the end of the program. So the primary mission of our program, PCRPP, it provides primary care clinical training experiences for medical students, that's you. And it also provides physician recruitment opportunities in rural and or medically underserved communities. You're going to hear that a lot. That's our goal, is to go back to those communities, those rural communities, those underserved communities, and be able to give you guys the experience of that setting. And hopefully you guys will go back after you graduate from medical school and consider working in those areas. Part of my job is to talk about the shortage. There is a major shortage of primary care workers in Louisiana. And again, that's what our goal is, our overall mission is maybe to encourage you to go back into those areas. Next one. So AHEC. AHEC stands for Area Health Education Centers. We are a community-based nonprofit organization, and again, our responsibility is to improve the quality and distribution of healthcare personnel in our area. So we're concerned about Louisiana. There's a shortage across the United States, but we're concerned about Louisiana. Next. So here we are. You were introduced to Ashley and myself. We are in the Bayou North. Gabrielle is CLAHEC. For those of you who are down south, you've got Southwest Louisiana AHEC and Southeast Louisiana AHEC. And they've already done their interest luncheon, I think last week. If you want, at the end of this presentation, we've got their contact names so that when you want to go back there, when you talk about going back home, at least you'll have a person that you can go to, okay? So you won't be in the dark. Yes, next. Okay, so again, this program is offered through a partnership of LSU and AHEC, okay? Again, not to read to you, is designed to give you an experience with patients in rural and underserved areas. That's our goal, rural and underserved areas. And that's going to be important when we talk about placements. Sometimes you guys, if there's someone from Monroe, you're going to be interested in being placed in Monroe. Well, Monroe is not considered rural. So that's, again, one of those discussions or conversations we need to have as to why you are being placed in certain areas. Next. Okay, so in this program, you'll be introduced to primary care in rural setting, clinical training. Again, we're going to provide you with an understanding and the value of the goals and the values and the goals of the medical practice. So this is actually going to be your first time out and about. Some of you guys, when you turn in your application, you have done some shadowing, you've done some other things, but this is going to be your first time out as a med student. The preceptor is actually going to count on you guys in some areas to do some things. So you'll really be able to take the theory that you've learned in first year, the stuff that you've heard, and really be able to apply it. So it's going to be a different setting for you, and it's a valuable experience. Next. We're going to encourage you to recognize the importance of understanding each patient in relation to his or her job and their total environment. The patient care that you'll provide in a rural setting is different from what you'll provide in an urban setting, okay? And so you'll be able to see that. And at the end of our experiences, when we come back, for those of you who participate, we're going to be able to share, you guys will be able to share with us some of those experiences. It's interesting, there are some doctors who don't have fax machines. Okay, so that's unusual for us. So you'll be able to see how these particular doctors function in their particular communities. Again, provide a student an understanding of the rural physician's role in the community, demonstrate the need for primary care physicians. Next. And that's Cameron. I don't know if y'all know him. He's in the second year. I don't know. Oh, there he is right there. Ah. Okay, next. Yes. Okay, what you will get out of this, okay, observe to be a part of all aspects of the practice. When I say all aspects, I mean all aspects. You'll be called out at different times. Different doctors, again, do rotations at nursing homes. This isn't a place that you're just going to be in the office, guys. You're going to be in the community. There are some cases where you'll be asked to go to Rotary Club meetings. You'll be able to go home visits. Again, it is a very good experience of something that I think will greatly impact your practice and your thought of medicine. You'll learn the significance of the patient-physician relationship, and that is so important in a rural practice. Understand the importance of the human and environmental interactions in meetings, in meeting the needs of the patient healthcare needs. Again, kind of saying the same thing. Next. Again, through observation, and it says through observation, in some cases you're actually going to do some things. You're going to be asked to do vitals and asked to do some things. So through observation, you'll learn the techniques commonly used in prevention, diagnosis, and treatment. You'll understand medical problems. Dr. Eric talks about hypertension. That's a big deal. All of those kinds of things you'll need to be able to research before you go into the rural community, because that's a real issue, okay? That's a real issue across the board. So you'll be able to see it live and in person. You'll become familiar with the community and the resources in that community that allow the clinicians to deliver high quality health care in those rural and underserved communities. And we say that, I want to keep making sure you understand, it is in a rural and underserved area. So when you are placed, you're not going to be placed at the big hospitals, you're going to be placed at those little clinics and those rural areas, okay? Next. Okay, again, now this is a big thing for AHEC, because we're trying to get this message out to our population. You'll gain an understanding of our core values, what AHEC is all about. Interprofessional education, behavioral health integration, social determinants of health, cultural competence, practice transformation, and current and emerging health issues. those are some of the things that you're going to be able to ascertain when you go through this particular program. Next. Okay, so the question is, are you doing AHEC? I'm hoping that because you're here, you've kind of already made a decision. You've got good word of mouth. Have y'all heard good things about us? Yes. Okay, yeah, okay. Thank you, Dr. Eric. Okay, hopefully you heard good things about us, okay? The program is very beneficial. So the question is, are you doing AHEC? I'm hoping that because you're here, the answer is yes, okay? And that you can spread the word about what the program is about. We've presented you guys with applications, but if you have a friend, I know someone picked up an application for a friend, those applications are available online. You can go by Ms. Shirley's office. She introduced herself. She's on the 5th floor. If you haven't been by the AHEC program office, I suggest that you go by there, even if you don't participate, because there are other opportunities available. You need to know where the resources are, and the AHEC program office offers and has a lot of resources and has a lot of information that can help you matriculate through your medical school career. They can also be downloaded. So really there's no reason for you not to even consider us. Okay, next. Okay, so these are some of our students. It's kind of hard to see. Next. Okay, so this is the thing. So you're getting the application today. The application deadline is going to be January the 26th. It's kind of a tight deadline because once you turn in the application, then the work that Ashley, myself, Angela, Polly, that's when the work begins. We actually have a bulk of the work to do because we're actually working for you to place you. So next slide. So this is the timeline. So applications are due to the program office January 26th. We're going to do phone interviews. So again, I know you guys, your schedules are busy. We kind of do them the same way. We'll send out a list. We'll set up a phone interview with you, about 15 to 30 minutes. Again, we want to make sure that, like with any interview, you're in it for the right, you know, and we're just trying to make sure we talk about placements and where you're from. We believe that communication on the front end is the best, okay, so that you're not thrown off by anything, you know, and you have the expectations and know what this is about. Our placements, we would like to have our placements done before spring break. I think spring break for next year is going to be around March 29th. So by the time we do the interviews, we have February and we have March. And let me explain something, because I think a lot of students don't understand what it takes to do placements. We have to call these doctors. So for instance, you are? Kevin. Okay, I know you. So Kevin is interested. Let's say I'm going to use one of my areas. Let's say Kevin is from Shreveport. Shreveport is not considered rural, so I'm going to have to place you somewhere else. So let's say I call Benton or Minden. And so we call the doctors. It's not an automatic every time we call the doctors. We have to wait on them to say yes or no. We explain who you are, what you're interested in. We're basically selling you, okay, to this particular doctor. And so that's why we have to have that amount of time in order to make the placements. We want to make good placements. There are some doctors, okay, just be honest, I may get in trouble. There are some doctors who we kind of stay away from just because of the past experience, okay? So we want to make sure when we place you, Kevin, you are in a place that you're going to be happy with for 4 weeks, because you will be there for 4 weeks, okay? So after you are placed, you will have an opportunity over spring break. We will call Kevin and say, Kevin, you are with Dr. Apshire, just whatever, and you will have an opportunity to call. You will need to call that doctor or the office manager, because again, in small hospital clinics, they rely on their office manager. So you will call the preceptor or the office manager, set up a time and introduce yourself, blah, 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 and talk about the expectations, what to wear, you know, those kinds of things. If there's an opportunity for you to go and meet them, yes, you can do that. But in most cases, because of time, a call is the best. Now, let me also make a plug here. On the application, it gives you a place where you can list possible preceptors. We don't want you to call preceptors, so I don't want you to call anyone. You can list someone if you're from an area. Am I right? I'm like, okay, just if you have someone, let's say I'm using Dr. Apshire, so if Kevin has a personal relationship with the doctor, you know them, then list that on there. We still need to make the contact because we are responsible, okay? This isn't my buddy friend. I had a case last year where the student was, the student's parent was a doctor and they wanted to shadow that there. No, okay? You probably have shadowed all during high school. We want you to have a different experience, okay? So I want to outline some of the challenges we've had. If you, like I said, if you have a friend, we'll do, if a family doctor that you know of that you've used, we have no problems with that. But it doesn't behoove you to stay with someone that you've been with or that you shadowed in high school. You want a different experience. You want to see something different. This is not to make you comfortable. It's not an easy experience. It's not just something to do. It's something that you want to go into and you want to make a point. I want to get something from this I want to get something from this program, okay? So there is that place on there for you. You'll return your confirmation preceptorship form to the AHEC office or to Ms. Shirley, or you can send it to our offices, okay, your individual offices. There's an orientation workshop that we're going to do in May. The date has not been determined, and it's there we're going to actually go through the paperwork, okay? There's some documentation that you'll need to fill during your preceptorship, and so we want to make sure we go over that with you so you understand what is expected, because at the end of the program, you're going to expect your stipend, and we can't release and will not release that stipend until all of the paperwork has been completed. And then the dates for next year will be June the 4th through the 29th. So if you are participating in Camp Tiger, and we do encourage that, we love that, you will be able to still participate in Camp Tiger and then still participate with us. Now, one other thing something that Ashley and we've talked about, if you are filling out the application and you're on board right now, good, right, we're great for that. If at any point during this process that you know that you're not going to participate, Kevin, call me, okay? Don't let us make the placement, because again, pickings are slim with doctors, okay? So we got to call. You know, I've got to call several times and, oh, I got this great guy, his name is Kevin, he graduated, literally I'm selling him. And then we get to it and the doctor agrees to take Kevin, and then we wait till 2 days, June the 1st, Kevin calls me and says, I'm not coming. Well, guess what? We're on the line, because you got to realize that office has prepared for you. Okay, they have set some things in place. They've said, you know what, office staff, we got Kevin, this doctor knows he's coming. Actually, they are excited to have some young blood, to be honest, to have someone in the office. You'll be surprised how many older doctors are out there, and then you've got this young student coming in, sharing stuff that they're learning now, and he's sharing some stuff that they used to do. They look forward to you guys. So be kind, okay? I'm going to try to be as nice as possible. Be kind to us and considerate. Even though you're not making the call to the doctor, I'm going to have to call and, you know, say, hey, I'm so sorry, Kevin ain't, I hate doing that. Do you hate doing that? We hate doing that. Hate it. So would y'all promise me, if you decide that you're not going to do that, if you're not going to participate for whatever reason, if you get accepted into something else, be kind to us and call us as soon as you know. Y'all agree? Okay, thank you. Okay, next. So these are the dates. Next, ma'am, if you don't mind. Okay, so I kind of have gone over this. For those of you who are going to be in Shreveport and who are going to stay here and in Bossier, blah, 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 in the Monroe area, you're going to be assigned to Bayou North. That's me and Ashley and our Chonda who works with us. Central is going to be Polly, going to be Gabrielle, and going to be Angela. Northeast and Northwest, those particular, I think their names are listed further down on the PowerPoint, but if you're interested in those, contact Ms. Shirley and we'll get you that, okay? Next. Okay, so again, they're based on the following factors. Primary care medicine consists of peds, family medicine, and internal medicine. So if you're interested in emergency medicine, that's not primary care, okay? So when she lists on here, when it's listed about, hold on one second, I'll come back. Geographical preference, availability of preceptors, there probably will be a case. So let me give you a real life example. Let's say you're from Bossier, from Shreveport, and I can't get you, for some reason, I can't get you in Benton. I may have to send you to Coshada. Well, Coshada is about 30, 40 minutes away, and generally we try to keep it around 45 minutes for travel, okay? If he's interested in peds, and I may say, hey, Kevin, I have a preceptor in Coshada. He's not peds, but he's family. Well, within family, are you gonna see some kids? Yeah, so we may have to fudge a little bit to get you into the program. So what I'm asking, one, be kind as far as telling us if you can't attend, but also be willing to negotiate. We're gonna try to get you OB. There have been, in Monroe, there are 2 doctors that I can use. Pickings are slim, if you know, so be willing to negotiate. We're gonna try to get you into the best placement, and we're gonna try to get you into your first choice, but that's why on the application it's giving you 3 choices, and we're gonna work with you as much as possible. Is that fair? This is a rough crowd, okay. Funding, I think we've got the money, okay? Again, preceptors, availability of preceptors, increase your chances, choose multiple regions. So again, if you live in Bossier, be willing to go to Minden or Benton, you know, Coshada, just kind of in that 30 to 45 minute radius, okay? Be flexible about location and dates for rotation. I needed to take that out. There may be some flexibility, but generally the way we operate in this area is that we all do the rotation at the same time. So from the 4th to the 29th. There have been some cases where, let's say, a doctor may be out a week, so we may be able to go up a week. Okay, we'll you're not participating in Camp Tiger. So the week that the doctor is out, I can have you work on Camp Tiger week, skip a week. You know, we can work with that in that time frame. But generally, we want to stay in the month of June, and that's good for you because you can plan on your vacation. You can get your money, go wherever you want to go. After we've had that, students will run and pick that money up, and we'll be at the bank before we can turn around. You know what I mean? They had their money. They had a need for that money. And I understand because I need mine on every 2 weeks too. So, but it gives you an opportunity to plan what you want to do before and after, and it gives you some time, you know, getting some money to have a little vacation before you go back to school. So be flexible. Next, ma'am, please.
Can I add one other thing?
Yes, please.
And it may be on the next slide, but if you are, like she's saying, Kevin from Bossier City, but you also have family that lives in Monroe that you can stay with, please let us know that as well.
Yes.
If you are willing to travel outside of your comfort zone, some of our hospitals or preceptors actually provide housing for you guys, whether it's through the physician apartments that they have located on their hospital campus, or some of our preceptors even have like private, personal owned camps that they put out for you guys. So be willing to kind of travel and experience something new. It's not a bad idea, and you still have, you know, several weeks to spend time with family before you come back to med school. So just be optimistic and be willing to kind of travel a little bit.
Now I will say this: our area, we haven't had, none of our preceptors have provided housing. So I'm just, again, there are different things, you know, different sites. So I don't want Kevin to come back and say, well, Gabrielle said y'all gonna give me some housing, you know. But my point is, different things, different preceptors will do. And thank you so much for, I know that happens.
And housing is first come, first served. So if you know automatically that you want to travel outside of your area and that you need housing, put it on your application, okay?
Depend that housing is not a luxury condo. Housing may be.
Yes. Thank you for saying that. So depending on where you're at, I'm not going to name parishes, but depending on different parishes, you know, they're not luxury condos. You may be in, if it's not a physician apartment, maybe they have physicians that they are putting up at that time during those 4 weeks that need those apartments. You guys aren't there yet, so you are going to be in maybe a hospital room. Not closet. We don't throw you in a closet. We won't do that. But I mean, we have a lot of hospitals, especially in our southern parishes, Baton Rouge, Ascension, East, West Louisiana, that do provide housing, but a lot of times it is part of their hospital rooms. But it's an opportunity for you guys to do some additional shadowing after your clinic office closes. I know ER is not primary care, but a lot of times they have some really cool stuff that comes in through the ER that you guys have kind of first dibs on, being that you're housed in that hospital. So just be open. There's a lot of really cool ideas that we offer through these programs.
Thank you. Next. Okay, so your coordinator, we will place you, rural, underserved. Like I said, but I keep having to say it, rural and underserved. Your stipend is $1,200. It's for 40 hours a week. Okay, so you will work. And again, like I said, a part of that may be going to a Rotary Club, you know, just nursing home visits. Your doctor is going to sign off that you were there for 40 hours. Now, again, you're going to spend some time with some nurses. You're going to spend time with the bookkeeper. You're going to kind of get an overall view of how to run an office. Okay, so if the doctor's out one particular afternoon, then you can actually do some research for the doctor. You could do a number of things. But again, those are the kinds of things we'll talk about at the orientation to make sure we're all clear so that you're meeting your what's expected, what's expected of you. So we'll mail and sometimes pick up. I have met someone at, where did we meet them at? At the grocery store? Oh no, we met somebody somewhere to give them their check. I promise you, we have met them. No, I was off, I came back to work and I sat and waited for this guy. Commute, stay with friends or family, local housing. Next. Okay, here are our peeps. Okay, you've met us. Gabrielle Juno, Polly Holland, Ashley Morgan, LaShonda Sanders. What I guess we'll do is email that. I'll ask Ms. Shirley to email that information. Y'all can give us a shout if you have some individual.
This is going to be posted, I guess Dr. Thomas will tell us, but this video will be posted. If you want to go back and reference it, you'll be able to look at the video.
Okay. So we've got Shirley Wilson, we've got Dr. Thomas, and let me have, this actually concludes the PowerPoint. Let Dr. Thomas introduce herself. She is our coordinator. She is our supervisor in this program, so she can share with you final thoughts. Are there any questions from me that you can, yes?
I have a couple of questions.
Okay, he has a couple questions.
In general, how many people get placed per year?
We placed, I mean, what we had what, 15, 16?
We had 25 before.
It varies every year depending on the number of applications we get. We don't turn you guys down.
That's right. You turned us down.
Yeah, y'all end up
Y'all
turning
turn
us
us
down.
down before we turn you down. I don't think I've ever turned anybody, but y'all turn us down before we turn y'all
But
down.
we also work with the other medical schools, so we do get applications from LSU New Orleans, occasionally Tulane as well. You guys are our priority. Bayou North and Central AHEC, our priority medical school is LSU Health Shreveport, okay? So if you are wanting a placement, 100% sure that you are wanting a placement, get your applications in early, okay? So once we get your applications in, we already start looking at potential preceptors even before your interview, okay? If you are from down south, Southwest and Southeast AHEC work, their primary focus is LSU Health New Orleans. So I want to make sure that you guys know that right off the bat. Or is anybody in here from the New Orleans area? Okay. I'm not telling you that they will not place you, but keep your options open. LSU New Orleans typically has about 85 to 100 at least students that they place in rotations every year, and they don't have enough preceptors for that area. So just like you guys are our priority from Shreveport, I can tell you without a doubt, every Shreveport student that applies will have a placement, okay? I can't say that if you apply through Southeast or Southwest AHEC, okay? So just be open-minded if you are truly wanting to do this program. Okay.
If we applied, like, with the Southeast or Southwest people and we didn't get a spot, would we have to send another application, or like, would it just be like, no?
So, I'm gonna be very honest with you again. If your first choice is New Orleans, where are you from?
Lafayette.
Okay, so if your first choice is Lafayette, usually right before your interview or around that date, we know if they will even be able to place you. If you wait too long and you don't put any other options on there, they may decide in the last minute not to place you altogether. We don't have control over that, basically. The two areas that we know without a doubt you will be placed is North Louisiana and Central and South Central Louisiana, okay?
So if you like Lafayette, you may be able to get you close, just depending on where you are, because we go into East Baton Rouge. And, you know, Lafayette, Baton Rouge is
Well,
another
even
hour.
Bunkie is about 45 minutes.
Yeah. So we can maybe get you on, like in the, if you were trying to go home.
Right.
But if you want to go to Lafayette, that would be a southeast placement. Southwest, that'd be southwest placement. Yeah. So, and then, okay, and I'll get this question. So, we will have our 4-week block. It'll be after Camp Tiger, because we know that most of the first years do Camp Tiger, so we don't try to interfere with that. But I don't know if we've been successful in allowing anyone to do our program as well as the summer research. So that's what most people end up really choosing between if you want to do PCRPP in the summertime, or if you want to start your research project, or just have this last summer to be at home with your family. Those are kind of the choices that our students usually have to make. And we just think this was a really good experience because you get that one-on-one with the clinician out in the community.
I was just gonna ask, so is Baton Rouge a shared place?
Baton Rouge will be, East Baton Rouge is our area.
Yeah.
So in that Baton Rouge area,
You will not be smack dab in Baton Rouge, because that is not rural. But you will be in rural areas surrounding Baton Rouge.
Now, he had some more questions. I'm sorry.
Yeah.
Yes, sir.
So can we circle more than an area, one area of interest?
You can circle 100.
And for the 3 preferences for locations, if you actually don't have a preference, and like you live like New Orleans, let's say for me, can we just like not put anything, just like completely be adventurous?
But just put a note on there that you need housing, if you don't have housing
Yeah.
in any other parts of the state.
Your preference may be a discipline as opposed to a location. So you may want to do internal medicine, or you want to do family practice, but it doesn't matter where. We can place you that way too. So if you have a preference for anything, let us know. How about that? Okay.
Kevin had a question. Didn't you raise, I thought you raised your hand. Okay.
Okay.
Okay, so on the town and parish, so say I'm from Monroe,
Okay.
would I put Monroe, or would you want me to put surrounding areas like maybe Union Parish, or place I know that's close by, or just?
You're gonna put Monroe, we'll figure that, yeah. And it's probably like Rayville, they're probably in that little area.
So, but also, so like, if we're from Lafayette, but like, we also have family that maybe lives near like Winfield or Alexandria, could we put those areas, even though they're not from the same AHEC office?
Yep.
Yeah, Winfield, Alexandria, that's our.
I have a great position in Winfield.
I'm like,
You would
visiting the family there.
love them.
Really?
And we have housing. We have really great housing in Winfield.
And it's, how long is your summer break? 8 weeks? 6.
Who wants to do research?
I mean, you know, so, I mean, you still have the summer. I mean, you still have a few weeks to go home. You do your 4 weeks here, and if you're close enough, you can commute, or you can go home on the weekend. However you work your schedule out, and then you can have that extra time at home before you start.
One more question. So say if I did get placed in Rayville, it's like 20, 30 minutes from my house, is that like, are these like, it's 40 hours a week, like you're working that every day, you're driving that every day?
Yes.
Correct. Some doctors do take off, but they'll let you know, and they'll either place you with another physician that's in their office, or they may set up for you to go to the hospital, but you'll still be able to get your 40 hours. We try to work with their schedule as well.
And if you say
Travel
you wanna
time
stay
does
there.
not count.
No.
If that's what you were going for.
No, I was just wondering. if,
Okay.
like,
Yeah,
That question does come up every
It
year.
weighs
there's
in
travel
to
time.
driving like 45 minutes
Yeah.
a day.
So if you want to, if you say you want to stay in Rayville, well, you need to know that, and we need to work on some arrangements for you if we have some.
We try to make it close. I mean, really. I mean, it's not our goal to make you drive out of the way. So again, like Gabrielle said, the sooner you get it to us, the sooner we can kind of start looking at our preceptors. And last year we even, through the program, there was a doctor in one of the offices who actually wanted to sign up to be a preceptor. So we can call a doctor and see if they're willing to, you know, join our program. Dr.
If you're interested in emergency medicine, don't limit yourself, because in these small areas, really anything can walk in the door. 'Cause a lot of times they're the only doctor in the area, and emergencies will walk in that door all the time. So just don't limit yourself to just think, oh, it's not emergency medicine. No, you'll get that at a rural clinic, you know, sometimes twice a day.
Thank you for clearing, if I said that wrong, thank you for clearing that up. That was good catch.
So, second year. Look at there. And what about AHEC students and been with us for a while, and so he has maybe some personal experience to share. So if y'all can ask him questions, we'll act like we're not listening. And take it away. Okay.
Well, first of all, I apologize. I've been in a renal exam for 4 hours, so if I don't make sense, it's because of that. But so I went to my hometown.
I'm trying to feel on you. You never know these days. I promise I'm not trying.
Okay, so I went to my hometown, Agena, which is where I wanted to go anyway. And so we have a hospital there. And so the main thing is everybody's experience is going to be so different from everybody else's in your class. So it just depends on who you get put with the whole time. And so that makes it or breaks it, you know. And like Gabrielle and them had said, if you have a problem with the doctor, you can let them know and they can get that resolved. But anyway, I had a great doctor. He was new. I didn't know him ahead of time, but he was from my town. I got to do everything he did, and we made good connections. And you know, he even said, "Oh, I'd like to work with you in the future. You know, keep in contact. You know, we're Facebook friends, whatever else. You know." So you know, it's a good experience. The only thing that I was like, oh, do I want to do this because of time? Because, you know, this is your last summer, yes. But just to give you a time frame, I finished first year, and then I did Camp Tiger, which was whatever. Then I had a day or two, and then I came to my hometown, did that for 4 weeks, and then I still went on a vacation for a little over 2 weeks and stayed gone in California for that whole time. So, you know, you have enough time to do Camp Tiger, to do that, and to go on vacation or just sit at your house. And so I think that helps you weigh research versus this, because I wanted to do something during the summer, and so you have research, which is going to be way longer than this program is. So do you want 4 weeks, or do you want to let it go until the school year, you know, like my classmates just presented a few weeks ago or a month ago, you know? So, and I'm not a research person, so that was another check, you know, we'd rather do this. So what I got to do on a daily basis was pretty much, they let me have free reign. I could do as little or as much as I wanted. It wasn't very pushy in the beginning. It was, here, you just follow me around for a few days and see what I'm like. And I got to know the nurses real well, and which I knew a lot of patients too, being from my hometown. So anyway, I had fun with it. But then as it progressed, he let me do more and more. We would do little procedures. I got to help with those, like taking out a cyst or something. He only worked 4 days a week, so that 5th day a week, I just would go to different other things in the hospital. So I actually thought it was good because you got to see, I did family medicine, by the way, I didn't say that. But anyway, so family medicine was that amount of time. Well, anyway, I would go with his nurse practitioners, or I would go do the hospitalist in the hospital, you know, if that was the only person around. So it was a good way to still see a little bit more. And do you have any questions? Because I'm just rambling.
Aren't you glad you did AHEC?
I am, yes.
We paid you and everything.
Yes, and so the paperwork part, so that's how you get your money. It wasn't that bad. It's just, you have to keep up, which my hospital was real nice about. They would print out a list of every patient's name that I saw that day. And so I wouldn't have to keep up with it. And so as the day went on, they would print me that list every morning, the nurse would, and I would go down the list and just make a note of what they came in for. Because on that sheet that you give them, they just want to know, the age or something and what they came in for and what you did maybe or something like that. So it's not that complicated. And family medicine, it was all cholesterol or, you know, high blood pressure, you know, it's a lot of the same things. But now that I'm in renal and, you know, we're talking about all these drugs and stuff, and that was one of the things. I was like, teach me drug names and how to learn stuff so that way it's not as hard now. I actually do remember stuff from it, so it helps.
You're going to get in with anything. You guys are going to get as much information or knowledge from this program as you put in. And like I've always told any student that comes through my area, it's good to, your initial conversations with doctors, set up a goal. Talk to them about what it is you want to gain from this program. If yours was learning more about medicine and the names of medicines and how they're used or whatever it is, so that you know without a doubt at the end of those 4 weeks you were able to accomplish that personal goal. Okay. Y'all have any other questions?
Did you do it?
I did it in Genome, which is close to Alexandria.
They have housing.
Yeah. Another thing, like, it's all about connections, y'all. Think about if trying to do it somewhere that you are interested in too, because you know I may go back to Genome because that's where I'm from, and the hospital administrator knows me by name. You know, it's, you know, like she said, oh, I want to talk to you. You know, that kind of stuff. Like, it's good. Try to get to know all the doctors there and the nurse practitioners. You know, it's a way to get your name out there. Yes, but we don't.
Y'all have anything else?
Well, if you don't have any questions, we thank y'all for coming. Make sure that you do pick up the application and you can download it from any of their sources or stop by Shirley's office and she's always available to answer questions.